supervisor, ER nurse, OB nurse, work acute care. I was interim floor manager for 3 months when they were going through a process of changing director of nurses. So I can tell you I like more hands-on nursing than I like book nursing. So.
I think what I love most about the nursing profession is every day you're making a change in somebody's life.
There's a lot of diversity in nursing too, so you have lots of open doors and opportunities to do things. You're not stuck with just one thing.
I like that no day is ever the same. I like the diversity and just the care that you get to give. You can take care of a baby one day, help bring a new life into the world. The next day, you're caring for somebody who's acutely ill or somebody who's injured in an accident. And you're just never the same.
What I love most about the nursing profession is being able to encounter people on a daily basis, like in their hardest times, whether it be a scheduled surgery or whether it be like sickness or end of life, just being able to be there for patients and their families.
Get lots of respect. Love my coworkers. I love coming to work every day, seeing the different variety, taking care of patients and their family. Just love all the areas, the interaction with the doctors.
I think for me the best part of my day is, in a smaller community you tend to know a lot of your patients, and just when they're in the ER and they're having a horrible day, something's gone wrong, and you walk in the room and they recognize you and they're like, oh, thank God you're here, or they give you a hug and they recognize that, and that just knows that, I've made a difference and that they can trust me to help care for them.
Yeah. And along with that being small hospital, you're coming into a family, so you work with people you enjoy to be with, and you know a little bit more about each other too.
And that trust with your teammates too. I mean, when it gets crazy and hectic and, stuff's going every which way, you can all pull together as a team and just do what you need to do to get it done and care for your patients.
I'm a morning person, so I love the day shift, getting up early in the morning. As a supervisor, making assignments for the staff, kind of seeing who your staff members are to give them the acuity of the different patients. I like having, that they are maybe only able to have 3 or 4 patients, because I think the task role can get done that way. So collaborating with the physician, making rounds, making sure the patient care is getting done. That's the biggest part, and as well as charting, that's the other factor in it. So
every day as a nurse will look different, depending on what department you work in. Ideally, your morning would start with patient assessments, just checking in on them, seeing how they're doing, obtaining vital signs. And you're doing all of this from the assistance of other staff members, such as nursing assistants as well. And then you pass your medications to your patients, and then patients typically have physical therapy throughout the morning or different tests and procedures. Doctors round at that time, so you can go around with the doctors and when they're visiting your patients, and really be able to take part and say what's going on with the patient and advocate for your patient as well. Then, you have your 3 meals during the day. And the afternoon often will be filled again with medications, patient therapies, rest, and you just attending to their needs. If you work in the emergency department, it depends on what walks through the door, and you have no idea what that's going to be. So it's kind of fun. Every day as a nurse is going to look different. No 2 days will be the same. And I don't like routine, so it's perfect.
As a nurse, I feel like you need to have good communication skills. You need to be organized, be able to critically think, be able to assess a situation and identify what the issue is and know how to kind of help fix that. You always, have your doctor there to help you too, but the nurse is the one that's with those patients 24/7, and they know what's going on with that patient. So you have to be able to identify that and have a way to fix that.
Some skill sets that are really important for the nursing profession include adaptability, so being able to go with the flow, change your plan throughout the day depending on patient needs, being able to advocate for your patients, to stand up, talk to the doctors, whatever the patient needs, being able to do that.
Compassion and caring to me means even on your worst day, you're still coming to work with a smile on your face and helping your patients getting through what is their worst day. So you're always present.
Because as a rural nurse, you get to do it all. It's not like you get to go and specialize in the ER or OB or whatever, and as you do in a bigger hospital. It's important for those nurses to stay up on top of that, and it just makes a difference for our patients because they have to come to us first in order to get stabilizing treatment before they can be transferred anywhere. And a lot of times it's important to get things treated timely. It just helps improve those outcomes for those patients.
Nurses can have any type of schedule depending on their lifestyle. You can work day shift, you can work night shift, you can work 8 to 5 hour shifts, you can work 12-hour shifts 3 times a week, which is what I do as a nurse. Most hospital nursing shifts are 6 to 6 or 7 to 7, both day and night shift. But it's really flexible too. So if you want to work part-time, you can do that. You can work full-time. You can just work on an as-needed basis. There are travel nurses, which are always needed too. There's just such a need for nurses that you are able to have a schedule that fits your lifestyle.
I think majority of nurses have always kind of started out as like a CNA and kind of worked in that aspect, and then attended nursing school locally and just liked it here and stayed and just kind of worked our way up the chain of command. And then as far as like, you kind of find where your passion really is after being a nurse for several years, and then you just kind of decide, I want to make more of a difference and step into maybe a leadership position or a supervisory position. And it's just kind of, that's the great thing about nursing is there's such diversity. You can go anywhere and do anything.
The first step is definitely just getting in the door, and CNA or anything along those lines, a lab tech or whatnot, to really dabble in what you do in healthcare will help open your mind and the doors for what could be next.